gonna start with the iliac crest. So find the patient's waist and just press down, and the bone you're pressing into should be the iliac crest. If my hands are here, I'm gonna turn around. Coming down and forward from the iliac crest, you should feel a nice prominent bump. This is gonna be the ASIS, right there, and right here on this side. For the PSIS, we're gonna spin around. Again, iliac crests are here. My thumbs are gonna come down and in. Okay, the iliac, PSISs should be about 3 inches apart. If your patients have dimples, the dimples are right at the PSISs. But again, small, slow circles, and you're gonna feel just a little bit of a bony prominence sticking out. Makes it easy to feel. Ischial tuberosity. Do you mind laying down on your stomach for me? You can do it standing up, but we're gonna be laying down here in a minute, so we'll just do it this way. Patient prone, take the heel of your hand, stay medial, and just press up, and you're gonna feel a nice bony landmark right there. That's your ischial tuberosity. Go ahead and turn onto your side. Greater trochanter of the femur with the legs straight. Start at the mid-thigh, come up, and it's gonna be this first little hill you feel. If your patient can rock their leg in and out, or you can help them do that, you will feel it clicking back and forth under your hand. Okay, go ahead and turn onto your back. Okay, and we're gonna do medial and lateral epicondyles of the femur. So if I come straight down the leg, the two bony bulges medially and laterally that stop me, this is going to be the medial epicondyle and the lateral epicondyle. Now on the medial epicondyle, there's the adductor tubercle. So if I feel the very start of it, this medial epicondyle is bulging out kind of like this. And what I'm feeling for is the corner where it starts to make a downward turn. Okay, and hers is going to be right there. Okay, her patella. To find the condyles of the femur, I have to move the patella out of the way. So if I move her patella laterally, right where the patella had been, I can feel the medial condyle. And if I move her patella medially, right where it had been, I can feel the lateral condyle. You have to keep the patella out of the way to feel these. If you move the patella and let it pop back, you're not feeling it anymore. Okay? Come down to the end of the table. Okay. Patella shows up very nicely right there. Here's her patellar tendon. It's nice and squishy. If you go to either side of that and feel a space, that's the joint line. If I press down, that's the tibial plateau. If I let my fingers fall to the front of the tibia, this is the medial condyle. This is the lateral condyle of the tibia. Stroke the front of the shin, you feel a nice bump. That's the tibial tuberosity. Okay. If I come around from the back of the knee, on the lateral side, first bump you feel, this is going to be the head of the fibula. Come straight down the leg, malleolus of the fibula, and then on the medial ankle, this is going to be the malleolus of the tibia. Okay, we're going to move on down to the foot. Calcaneus is the whole heel. You can point here or here or here or here or here, anywhere you want. This whole bone right here is the calcaneus. The talus is between the two malleoli. Move over. Okay, so the malleolus are here and kind of forms a triangle with the talus. Can you point your foot down for me? When the patient points, you have a lovely point. You see this bone kind of pop out right here. That is the talus. If your patient flexes their foot, it disappears and you can't feel it anymore. But when they point, it pops out right there. A nice talus. Okay. Navicular bone If you come on the medial side of the foot and you just stroke, you will feel a big bulge. It's up here, it's above the arch of the foot. This is the navicular tubercle that you're feeling. So that would be the navicular bone. On the outside of the foot, if you stroke down, right at the base of the fifth metatarsal, you feel a nice bump. That's the tuberosity of the fifth metatarsal. Okay. Other than that, we have metatarsals. Heads are going to be, go ahead and curl your toes. These are going to be the heads of your metatarsals. And then we have proximal phalange, distal phalange, proximal middle distal, la 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 la. And if the patient curls the toes, we see the heads pop up. And that's it.